Mothers-to-be are getting more specialty care thanks to a new program at UPMC McGee Women's in Erie. Matt Mathias is in our control room with more on the region's newest Doula program. Matt.
Yeah, that's right, Jen. According to the Department of Health data, deaths related to maternity and childbirth have increased in the Commonwealth since 2020. And UPMC McGee Women's in Erie is doing what they can to make a difference. According to the Pennsylvania Department of Health, almost 11 out of 100,000 women die from complications related to childbirth. And for about 50% of those women who die, it happens postpartum.
We have unfortunately seen, when we look at our data, a trend towards increasing losses either during the pregnancy birthing process or delivery or in the year postpartum, and as well as bad health outcomes related to what we call severe maternal morbidity or illnesses related to pregnancy.
Now the state is turning to programs that can improve outcomes. This comes as UPMC McGee Women's has expanded its Doula program to Erie. Doulas are specifically trained experts who offer emotional, physical, and informational support to pregnant women throughout their pregnancy and beyond.
Regardless of how many times a family has experienced pregnancy and birth, each one is unique, and once again, they need to have kind of a representative or liaison who they can contact and relate to and trust ultimately.
And UPMC's data speaks for itself. When patients have doula support, they're less likely to have a C-section delivery, more likely to breastfeed and breastfeed for longer, and less likely to have preterm birth. With the program now in Erie, those outcomes are a real possibility for expecting mothers throughout the region.
We see better birth outcomes when we're able to care for the wholeness of a person and meet them where they're at, mentally, emotionally, physically.
We're thinking about all the possible ways to improve birth outcomes for pregnant people and their families.
Now, doula services are free of charge and is available for expecting mothers who are interested. Just mention it to your doctor. Jen.
All right, Matt Mathias in the control room. Thank you, Matt.